Good afternoon, Mr. Trevino. The purpose of this video is to provide a psychoeducational approach to an aging client who's suffering from arthritis and self-medicating with alcohol. The focus is on educating the client to support them to adapt to their present conditions by learning how to manage their pain and attain healthy coping mechanisms. Psychoeducation is recognized as part of the therapeutic process as clients develop skills to live with their conditions. Ultimately, the goal of psychoeducation is to 1. Offer useful information pertaining to a diagnosis, 2. Allowing space for clients to process their emotions, 3. Supporting clients with medication, and 4. It actually offers tangible tools to become more involved in one's own healing process. And patient education very much contributes to the health and well-being of a person experiencing pain such as arthritis. Any sort of information, problem solving, and new coping skill has proven to be effective for symptom management. This particular client's presenting problem includes arthritis in her hands and knees. She experiences pain running up and down her spine and has a hard time getting out of bed. She complains that her meds are not working to relieve her pain and thinks that moving as little as possible is the best thing to prevent wear and tear. At the end of our visit, she stated, "If it weren't for the pain relief from taking shots of tequila, I don't know what I would do." Arthritis requires a medical diagnosis and refers to inflammation of the joints, which tends to worsen as we age. It is a very common condition, and symptoms include pain, swelling, reduced range of motion, and stiffness. Medications, physical therapy, or sometimes surgery helps reduce symptoms and improve quality of life. According to the Arthritis Foundation, there are over 100 types of joint pain or joint disease. People of all ages, sexes, and races have arthritis, and it is the leading cause of disability in America today. More than 50 million adults and 300,000 children have some type of arthritis. It is most common among women and occurs more frequently as we get older. Depending on the type of arthritis, the effects of a client's physical functioning might manifest as pain throughout the entire body. All of them cause pain in different ways. Inflammation starts in the lining of the joints, causing damage to both the cartilage and the bone. The damaged tissue then releases chemicals that alert nearby sensory nerves. These sensory nerves carry the message up the spinal cord to the brain. Your brain processes the message and sends a signal to your motor nerves to take action. Arthritis may also affect psychosocial functioning. It can be frustrating and affect all parts of one person's life. According to the Center for Disease Control and Prevention, more than 1/3 of the adults who have arthritis report that it limits their leisure activities and work. Psychosocial factors influence the perception of pain, and the presence of pain influences psychological well-being, as well as social participation, including domains of work, family life, and more leisure social activities. Coping strategies can be categorized in various ways, such as adaptive or effective, and maladaptive or ineffective. In this particular case, the client is using alcohol with prescribed medications to mask their pain, which I would consider a maladaptive coping mechanism. As our bodies begin to age, physiological changes occur that suggest increased sensitivity to alcohol. Body water content drops and fat content increases, and because alcohol is more soluble in water, older people tend to have higher blood alcohol concentration for any given dose. Medication in conjunction with alcohol ultimately hinders the process of metabolization and can specifically impact major organs such as the liver and kidneys. Arthritis is associated with increased risk of functional impairment. Alcohol may further affect cognitive functioning as well as physical health outcomes in older adults. Moderate doses can be beneficial, however, depressive symptoms tend to trigger people to drink more, affecting the cognitive and emotional evaluation of their lives. Depression is undertreated in older adults, heightening risks associated with illness and disability. A social worker may continue to be a resource for this client by incorporating cognitive behavioral therapy, also known as CBT, with the intention of bringing awareness to the client's thought process, which might be influencing their feelings and behaviors. This might support the client to recognize destructive thoughts or ineffective responses, reflections, set goals, and practice new strategies. Psychosocial interventions can also be helpful to mediate the relationships between life stresses and overall well-being. As a social worker, I would implement skills to support active coping, feelings of hopelessness or depression, and self-efficacy. Chronic pain and depression seem to go hand in hand. In that regard, I would incorporate yogic tools such as asana, physical dynamic movement, pranayama, breathing techniques, chanting, and meditation to help the client further explore their conditions and learn how to maintain their symptoms by utilizing nourishing, focused interventions. Essentially, anything revolving around mindfulness and calming the system can help direct and distract the mind away from the pain and into the present. Additional informational resources that may be given to this client might include offering different kinds of therapy, such as narrative therapy, which goes very well with remnants therapy, and both of these can potentially aid the process of CBT to separate the ailment from the client and to get them to see their external experience that's being shared with other people as well. This can also reassert a sense of purpose for the client and allow them the space to reflect on their lives and manifest a new story that includes this part of themselves. Appropriate community services to refer the client to might include group therapy focusing on older adults experiencing symptoms related to arthritis and alcohol. AA meetings can also be supportive. Ultimately, any sort of human connection. In reference to the gerontological aspect of social work, this semester has offered me great insight into a population in which I will one day become a part of if I'm lucky. The various theoretical approaches we've explored have very much supported me to gain further insight and understanding into this particular demographic. Prescriptions for helping, specifically deep listening and reframing, have been invaluable skills that I've gained throughout the duration of this semester. Our exploration around race, ethnicity, disability, gender, sexual orientation, and social class have also very much contributed to developing more cultural competency, to consider various perspectives regarding each person's unique experience. This semester has very much inspired me to further my work with this population and to continue to utilize a client-centered approach that will allow me to meet each individual where they are along their life journey. I feel much more capable of meeting the biopsychosocial needs for older adults, connecting them with community resources, and providing care to individuals requiring different levels of service. Thank you very much.